One.
Hello, I'm Dr. Sheila Davis from a Natural Way Family Health Clinic in Byron, Mississippi. I have a short message for you. It's entitled The Weight of the Pandemic. Overweight. Americans gained 12.5 pounds on the average thus far during this pandemic, and this is only September. The more common reasons listed for gaining the weight included 72% said just lack of exercise. 60% said it's just stress and emotional eating. And then there's that group that said stress, emotional eating, and lack of exercise. Now, that's not germane to just the United States. Internationally, we have some figures too. Italians, 66% indicated that they had gained weight during the pandemic. Brazil, 60%, and even Japan, 50% of residents said yes, this pandemic resulted in weight gain. Now, we know that just a few extra pounds of weight can make a difference in things like our blood pressure, our blood sugar, heart disease, and we have also learned that those extra pounds increases our risk for COVID-19. One statistic that's very alarming that I became aware of comes from the Mississippi State Department of Health. And Melvin and I are located in the state of Mississippi right now. They indicated that over 38% of COVID deaths in this state occurred among African American women. That's right, 38%, which means the fatality rate for African American women with COVID is twice that of white men, almost twice that of white women, and substantially more than even black men. So what is this thing about black women and dying from COVID-19? We're going to unpack that in just a moment. Nationally, when we look at COVID deaths, they look at that by deaths per 100,000. African Americans die at the rate of about 74 per 100,000. Remember that figure. Hispanics, it's about 40 per 100,000. American Indians, about 40 per 100,000. Asians, about 31 per 100,000. And Caucasians or whites, about 30 per 100,000. So if we were to look at that again, the rate of death from COVID for African Americans is nearly twice that of other race people. The Office of Minority Health offers a few more cues or clues to that puzzle. They state that among African American women, 4 out of 5 of us are classified as overweight or obese. 4 out of 5. So, what does that have to do with COVID? When you look at it, African American women are more likely than not to be classified as those essential frontline workers, in retail, people who are the custodians, the fast food workers, and things like that. We kind of make up that group. So when you think about it, if we, number one, are those make up primary those essential workers during this pandemic, and number two, and if we are more likely to be overweight and obese, those are 2 major risk factors that put us at a greater risk of contracting and even dying of COVID-19. Obesity also increases our risk for diabetes and heart disease, and as I just said, stroke and COVID-19. So are we doomed to that? I don't think so. That's why I am talking to you today. We have a solution to that. Hold tight. At a Natural Way Family Health Clinic, we were just strongly impressed to create a weight loss or health restoration program before the pandemic. In January and February of this year, we tested a program among a mixed group of women, and I tell you, it was short of miraculous. It was an 8-week program, but by week 6, we were beginning to see results. I remember Kim calling and said, I got something to tell you. I have something to tell you. Kim was long-standing diabetic, not very well controlled. Her hemoglobin A1C was at 9 and higher most times, but within the first 6 weeks of our program, for the first time in a very, very long time, Kim's hemoglobin A1C dropped to 7. And for those of you who don't know, the hemoglobin A1C really is a measure of the average blood sugar over the past 3 months. And that's an important indicator for people who have diabetes. I remember Diane telling the group that she went to her doctor in about week 6 or 7 of the program, and her insulin had to be reduced because her numbers were so much more improved. For me, I began the weight loss journey, and I know I've been up and down, but this time I started losing weight in January with the people in that program, and I have continued to lose that weight. And I am pleased to tell you, in just a few short pounds, I am not going to be classified as one of those overweight ones. So, as COVID set in, we realized we needed to transition to a more online program. So the second iteration was a synchronous online health restoration weight loss program. And with that, people were online with us, and we kind of did that live. That was good. And then once again, we saw good results that led us to what I'm sharing with you today. Our third iteration is a complete online health restoration, and I emphasize health restoration online weight loss program. It consists of 8 tutorial sessions. With that, I give you a one-on-one consult. As some of you know, I'm board certified as a lifestyle medicine professional. I'm also a family nurse practitioner, and I have several other credentials. Won't bore you with, but I'm well qualified to do this. But I will give you from a 30-minute to a 1-hour consult to get you started at any place in that sequence of those 8 tutorials that you would take on the session. Now, let me tell you just a little more about the program. No calorie counting. Read my lips. No calorie counting. You go at your own pace. You can access those units or those tutorials as often as you like. You have the one-on-one consultation, as I said before. In this program, you learn how to eat more and lose weight. We use evidence-based principles of weight loss and health restoration. In so doing, you reduce your risk for things like diabetes and hypertension. You reduce your risk for stroke and GERD, and I could go on and on about the lifestyle.
I can piece it together.
That's okay. In essence, the health restoration online weight loss program, there's no calorie counting, none. You go at your own pace. You have one-on-one consultation with me, as I shared earlier. You learn how to eat more and lose the weight. We use evidence-based principles on health and weight loss. In so doing, you reduce your risk for all of those lifestyle-related conditions like diabetes, hypertension, high cholesterol, GERD, certain cancers even, and so on and so forth. And yes, in so doing, you also reduce your risk for COVID-19. You learn how to let Food be your medicine. And yes, we are culturally inclusive. Now, what's the cost of this program? We polled the group and we asked them, how much are you willing to pay to reduce diabetes and so on and so forth on a type of program like that? For those who have gone through the program, they start at 300, 400, 500, 600 and on. We are missionaries. We have a nonprofit organization here. We're not here for the money. So we cut the cost to the bare minimum. So we are willing to offer you this program for $149. That's the whole package, including the consultation. $149. If you are interested, you think about it. You do whatever you need to do. You pray about it. You think about it. But I know it's well worth it. Go to our website, www.patienthelp.care. www.patienthelp.care. C-A-R-E. I look forward to hearing from you. I want you to make your goal, and most of all, we believe that the Lord wants you to prosper and be in health. Thank you, and may God bless. Bye now.